Good morning, Peter Goertz. I'm a psychiatrist. I want to talk about interacting with patients with borderline personality disorder. About a week ago, a doctor in training, a psychiatrist in training whom I work with, had interactions with a patient, and the patient sent her messages that were caustic, verbally abusive, and that can be quite difficult for us to deal with when we treat patients. And of course, it's very difficult. Primarily, the issue is it's very difficult for the patient to deal with, of course, that intense emotion. So, and that's the key thing about patients with that diagnosis: intense, unstable emotion. And I actually enjoy working with these patients. I find them very instructive. I find them very interesting to work with. And I find that I learn a lot from them. And they can be quite challenging. And I think I like that also. They really make you look at yourself and at your own issues. And one basic thing to realize is diagnoses do not capture every patient for sure. Every patient is different. And a label like borderline personality disorder only means so much, is not necessarily meaningful for an individual patient. So, in my opinion, you want to approach them as a real person, as a human being. And one example is, I remember a patient I was getting from the waiting area, and she had her hair dyed a very interesting color. And I asked her, "Is that your natural color?" And she laughed. So that type of thing, in my opinion, sets the stage for an interaction on a basic human level, instead of having some kind of more, quote, professional interaction in the sense of the treating person being on a different level from the patient. You want to see yourselves as on the same level. We're both human. We both have problems. And these people can really push your buttons. They find your sensitive, vulnerable areas, and their comments can be scathing and really hurt people. They can comment about your appearance, your religion, your accent, whatever it is. They can really push your buttons and evoke intense emotions in you. They can curse. They have often a very labile mood. They can push to extend boundaries, push boundaries, want to extend visit times, ask for telephone calls outside of visits, which can be quite infuriating for the treating person because that adds time to your day, and you may stay late doing things like that and ultimately resent the patient if you don't watch out. And they can threaten suicide, which will get your attention, and they, of course, can also complete suicide. So you definitely want to take them seriously and evaluate each situation individually. One basic thing that helps me in interacting with them is to realize that almost all of them have been severely traumatized, sexual, physical abuse in childhood, for example. And it's really worth reminding yourself of that when you approach these patients. Like, let's say you're working on an inpatient unit and a patient is screaming in the hallway, and that patient carries a diagnosis of borderline personality disorder. In my opinion, you want to approach that patient having in mind that this is likely, very likely, a person who's been severely traumatized. And if you envision them like a baby crying out for help or attention or mother's milk, that can really set the stage for coming to them with an attitude of wanting to be helpful and tending to be helpful. And that can shift the whole interaction. And another thing that's helped me is to realize that in most situations, what they're doing is not intended to be personally against you. It's coming out of their own intense emotion. So just like if you're walking down a street in a big city and a psychotic patient is shouting obscenities at everyone, you're probably not going to take it personally. So analogously, when a patient with borderline personality disorder is abusive to you, likely it's not personal, and other interactions may not be personal either. I remember a patient who came to the emergency room many years ago with her friend, And she was scathing towards her friend, telling her to shut up. And then right after that, she asked me, "Are you single?" And so things can shift on a dime, and her asking me out wasn't necessarily even coming from her being enormously attracted necessarily to me, but probably to a large extent from her own intense emotions that may not have had much to do with me. Thank you.